You're welcome to Expect the session with one of our experts. Today we have a drug expert. And I'll allow her to introduce herself. This program is aimed at bringing experts to give their view on certain things that is happening. Today, a lot of people can go online and they'll Google a thing, or maybe they'll ask ChatGPT about certain things, but ChatGPT will only give feedback based on what you ask them, but they cannot tell you from the expert's view. That is why this program is in session, that it will help everybody to take right decision and have an expert view on everything they want to do. So today we are with... Please introduce yourself.
I'm a pharmacist and I go by the name Dinah Eva Nanweki Lanyo. Thank you, Nana.
Your name alone, you're welcome. Your name alone is...
It's a drug.
No, it's a drug.
Yes.
It's a name of drug. So...
it gives therapeutic outcomes.
Outcomes,
yes.
Yeah, that's nice. And I would want you to let us know more about a pharmacist, like a dispenser or...
Okay, I'm a pharmacist.
You're a pharmacist?
Yes, I got my degree from Kwame Nkrumah University of Science and Technology. So I am a pharmacist.
Okay.
Yes.
So certified pharmacist.
Yes, certified.
Right. So meaning your certificate and your license can be used for other things. Or like if you prescribe drug for somebody, like it means it is authentic.
Yes. Okay. At the community level, we are allowed to treat disease of common occurrence.
Okay. Okay. So what's the difference between you and a medical doctor?
Okay. The pharmacist is a drug specialist, is a custodian of drugs.
Okay.
Let me put it that way.
Okay.
So however the drug is being produced, how it's going to work in your system.
Okay.
All the processes.
Okay.
Yes. And the medical officer actually takes care of you and gives diagnosis. In our country, you prescribe the medication. So when it gets to the pharmacy, the pharmacist would have to go through it, go through whatever has been prescribed, look at whether everything has been certified. So we make sure the wrong medication is not getting to you, and would advise you on how to take your medications and probably expected side effects and everything. So we are champions of medicines or drugs.
Okay, I see. I know that your duties and your functions at the hospital is very, very key, because sometimes a doctor will give prescription, and you, the pharmacist, have to also make sure that the condition of the person and the drug given to the person is not going to harm the person.
Yes,
so
exactly.
It's very, very important, and I know of that. And please, Dinah, can we... Why is it that some people abuse drug, or some of the drugs are made beyond the capacity of the people of the patients? Do you understand the question?
Yes, I think to an extent. Let me try and answer. Okay, so when we take a medication or a drug, it's intended to go and cure probably a condition or use in managing other conditions that you may have. But every drug, as much as it's going to do good to your body, it's also a potential poison. Every drug is a potential poison if not used how it is intended to be used. That is why we may tell you to take a number of tablets of paracetamol. Maybe 500 milligram. We decide that take 1,000 milligram this number of times to be able to cure your disease. But as the medications go into your system, just as you see when food enters your body, you know eventually it comes out. It goes through so many processes passing through organs. There are also organs that excrete these products. The byproduct of these products, it excretes whatever your body has not absorbed. Yes. So if you don't use the drugs within the specs that you are supposed to use. We've given you a range, an amount you are supposed to use. You are going to put pressure basically on all these organs, and it may cause harm to you. Yes. So at a dose, we know that at this dose, it's going to work this way.
Okay.
But when you change the dose or change the frequency, everything, it could give you a different effect.
Okay.
There are medicines that at one dose will be doing will be treating one condition, but at a different dose may be doing something quite different.
Okay.
Yes.
I wanted to ask because sometimes you go to the hospital, you complain of your head. They'll give you a head, okay? Like they give you maybe paracetamol or ibuprofen or other drugs that kills the pain. But you go to the herbal medicine doctor, they will tell you that particular drug they are giving you, it can cure malaria, it can cure fever, it can cure diabetes. Like, I don't know what I understand.
Yes.
I want you to differentiate between the traditional drugs and the herbal drugs. Why some of the herbal drugs cure 20 diseases, but when you go to the hospital and you are using a traditional drug, if it is headache, it's headache. If it is stomach, it is stomach. Why is it so?
Okay. I believe when you go to the hospital and complain of things, we may not just be treating the symptoms one after the other.
Okay.
That's why the medical officer will listen to everything you have said and make a conclusion.
Okay.
All your symptoms you may mention may be pointing to one disease. You don't know.
That's true.
They may all point to one disease or give us an idea to probably conduct further tests to ascertain what we are suspecting.
That's true.
Yes, when you come to herbal medications, I'm not against herbal medications. I love herbal medications.
I know.
Yes. And it is possible most of the drugs, as has been mentioned, may be targeting those different diseases.
Okay.
Yes. We are still in the stage, we are still developing in the country when it comes to herbal medications. So for some of them, you may need very high doses to cure. So if you look at them, sometimes you may have to take about 30 mils, about 50 mils. That is a lot. That is why we have a regulatory body for even the herbal medicines. They're supposed to go through
the scientific process.
Be certified by the organization, by Food and Drugs Association. You can be assured if that medication has gone through the processes and has the Food and Drugs Authority logo on it, showing that it's gone through the processes. Because when you take one single plant, it could do several things.
That's true.
But as much as it could do several things, there are also some other substances that could cause harm to you.
Okay.
So there's a need in preparing it, probably to get those things isolated so that you get you the active ingredient, the ingredient that's actually going to do whatever the drug is intended to do.
True.
That is why we advocate that they go through the certification, because they'll take you through, so they'll test your medication, go through all the processes and certify that it is actually safe to take and for whatever intended use it has been stated, it's actually true. So sometimes you notice that maybe once a while FDA will come out, and it happens with even the orthodox medications, that maybe they want to pull this medication out because it has not been certified by the Food and Drugs Authority, and we try to blast them and stuff, but everything has to go through it. If it's a medication we are not, if that was not even produced here, produced from outside, that doesn't mean it is totally safe. We still have to test it and be sure that they meet all the criteria before we take it. So it's very necessary that in getting your medications, you get it from an authentic source. Let me put it that way. That is
that's fine. Okay, so I'm a patient. I'm going to the hospital, right? And when I got there, I complained of certain places that maybe my back is paining me, and they said I should go and do lab. They did all the things and they concluded on a diagnosis, and afterwards they gave me a drug. after taking the drug, the case worsened. And maybe they said I should come to review on maybe 3 or 4 days time.
Okay.
Till that day, I'm still complaining about the pain. The thing is not going. Even some has been added. What might be the cause? From drug perspective, that drug has been ushered to me, like the diagnosis has been identified,
yes,
and the problem has been identified that there's a drug giving me, but still my problem is persistent, even multiplying. Does that mean that sometimes some of the drugs worsen the case before it cure it or something? Like that is what I want to know.
Okay, not really. It may not be worsening your case,
okay,
but we are all different.
Okay.
Do you get it?
Okay.
And the medications are also, even when you take painkillers, we have different groups.
Okay.
Some people may be reacting to one group.
Okay.
Some may be okay with a group.
Okay.
Do you get it? Some people may not even know their allergies from beginning.
Okay.
This is how we get to know someone reacts to a particular type of drug.
Yes,
do you get it?
Yeah.
And we run certain tests. We have probably certain basic tests to be able to identify.
Yeah.
They may have been probably something more we haven't captured.
Yeah.
So the most necessary thing to do at that time is to return to the hospital.
Yeah.
Because that is where we can probably do further tests or identify that no, this medication may not be appropriate for the condition you brought.
That's true.
Yes, it could be so many different things, but it's not necessarily going to worsen your case.
Okay.
There could be side effects of medication. Sometimes we would tell you you expect this, you expect to feel this way. It's like taking artemether-lumefantrine, the malaria drug. People are really scared of it. Artesunate-amodiaquine is a very good medication, but because of the perception people have had about these medications, but per advice, per our counseling, we will tell you probably the foods you may have to take with this, things you may not have to take with this, the time you would have to take it. But anything can happen. So if your symptoms are persistent after taking it, if it's worsening, you need to return.
Okay.
Yes.
Okay.
Because
so, Doc, I want to know something. Anytime somebody got a condition of maybe ulcer, what they will say is that don't take NSAID, don't take this, don't take that. My question is why, and even some of the causes of ulcer is taking NSAID.
Too many NSAIDs. It's a good cause.
Yes, a good cause. Yeah. Why is it that the drug that's supposed to cure the body is giving another condition?
Okay.
Do you understand?
Yes.
Yeah.
So I can see you are speaking from experience.
Maybe.
So with medications, as I said, you are supposed to take it within the dose that we've prescribed for you.
Yeah.
And if you see sometimes paracetamol, you'd come and we'll give it to you for 3 days.
Okay.
You go and buy extra and probably take it for 2 weeks.
2 weeks, yeah.
That is prolonged. That is why when you come and you even have pain, even diclofenac, the NSAIDs, you don't see us telling you to go and take the NSAID for 1 month.
Okay.
Because of the mechanism with which it works.
Yeah.
We know it could cause other things with prolonged use.
Yeah.
So we would like you to take it for a number of days.
Yeah.
Come back to the hospital if your problem is not resolved. And let's move on from that.
Okay.
But then we tend to probably self-medicate a lot. When I went with this condition, the doctor prescribed this for me.
So let me go and buy it.
Let me go and buy it myself. Let me give it to my brother who is complaining of the same thing. His symptoms may be similar, but the condition may not be the same.
Okay. Okay.
Because you yourself, when you were sick, you went to the hospital, you didn't go and consult your brother.
Yeah, that's true.
Why have you become a sharer of medicines? Yes.
Google doctor.
Yes. That's why I'm saying if you take it within the period and at the dose we've told you to take, we are expecting that you'd be cured or you get healing or to manage whatever we are trying to manage.
Okay.
Yes.
Okay.
And not give you anything.
Yeah.
However, there are side effects, as I said,
And
of
even
many medications.
I wanted to ask that why almost every drug has a side effect. Do you understand?
Yes.
Almost every drug has a side effect.
Yes.
And dizziness, nausea,
yes.
other things.
Yes.
Fatigue and other things. Why almost every drug has side effects?
Yes.
Why?
So, in producing drugs, as much as we are researching on how it's going to help your body, there's a portion where it's tested on animals, some are tested on humans subsequently. We expect that once it's a chemical entering your natural body, it is something foreign coming into your body. And as I said, there are so many organs in your body. That's maybe when the drug is absorbed in your body, it could go. If you take headache and we give you a medication, it's not, the medicine is not traveling just to your head, probably to just work on your headache. It's a painkiller. An analgesic, curing pain. Yes. So it will work to cure the pain wherever it is, not just your head. Do you get it? Because it gets absorbed into your bloodstreams and works wherever it's supposed to work. There are certain things we call receptors. So wherever it's supposed to work, it knows a specific receptor, it will go and bind to and start working. So we can't promise having no disadvantage of everything. You could love drinking water, but if you decide you are so thirsty, you pour the whole water, you drown in your own cup. You can't swim. If you enter underwater and decide not to hold your breath and breathe, you can drown. If you decide to wear this shirt every single day, I mean, we'll start wondering and would wonder why you are wearing just. So almost everything on earth has a potential side effect. So the best thing is we identify some, but some of them we are not able to identify. Yes.
So Doc, this question is a bit somewhere, but let me ask. We have in our society now, we have discovered that some of the drugs have bad effects on our kidneys and our liver. And due to that, some people decide to take the drug not from oral perspective, but some will take it from their anus, some also put it under their tongue, another thing. I want to know, like, those processes, doesn't it affect the liver or the kidneys?
The issue is that taking it, we have different medication and different formulations. We can take diclofenac, we have the gel. We have the capsules or tablets, we have injection, we have the suppository as you are saying. And it's all intended for analgesia or curing pain. But depending on what you presented with and whatever we want to achieve, we know which ones to give you. Yes. If you take even the inner roots per se, people think when you put it there, it's probably just working around. But then the anus has a lot of blood vessels.
Oh, really?
Yes, because that is highly vascularized. So even taking it, inserting the medication there, it gets easily absorbed into your bloodstreams, even faster than the oral.
Oh, really?
Yes.
Oh, I see.
That's why I see when kids get, when they get high temperature, they are convulsing. We give them paracetamol suppository because it can help bring down the temperature quite in a good time. In a good time. So I'll continue to say it's the dosing we are concerned about.
Not the process.
Oh, not the process. None of the processes, because some of them have local effects. As in directly, maybe it could harm the lining of your tummy directly, something like diclo. But it also has an effect.
When you take it otherwise.
Yes, not even just directly, but its mechanism of action can produce certain other things, or once it's even in your bloodstreams, when it gives rise to certain things, can also cause processes that will harm your tummy. It's not just a direct effect. So when we say you should refrain from it because you have ulcer.
Yeah.
We don't tell you that refrain from the oral.
Oh, okay.
Yes.
Yeah, I understand.
Yes. Not all medications may be behaving that way, but something like NSAIDs, yes. We may not tell you to stop just the oral, because it has effect. Still, even when you take it by injection or by the suppository.
Yeah, you made mention that you were saying maybe I have a friend because of my condition. He's also complaining about the same symptoms, and maybe I came to see you, and you said, Eric, when this happens to you, buy this, buy that, buy this, or get this, get that. So okay, I got it. It worked for me, and I called my brother. I said, oh, don't worry, go and buy this and that. He also buys it. It works for him. Is it a good practice?
It is not. It is not, because when you came, you noticed that we don't ask you just one question. We try to dissect everything, ask you so many questions, and try to get as much history as we can get, including something you've taken. And maybe you may have taken a drug, we know it has that effect, but you may not have that knowledge when you were prescribing for somebody. And let me chip in something that has to do like antibiotics. Because sometimes people may have headaches and decide they want to take amoxicillin. Yes, it is not a painkiller. And you take it and probably feel your pain has gone. Most likely your body has a way of fighting diseases too. It may have fought it on its own. But because you took the medication, you feel it is the medication that did the job, but so, it had no role to play.
So is that the placebo effect thing?
No, it didn't really do anything to your body. You are just you are rather contributing to resistance. Yes. And antimicrobial resistance. Because when you do not need them and you take them, it doesn't go and do anything in your body. But then your body is rather going to probably get so used to the thing that the day you need it, we give it to you. It knows the drug so well, it's not going to work. That is one of the things, because you could have certain things and you would appear, maybe a cough, and maybe a viral cough. Viral disease will resolve on their own. We may just have to give you probably a cough syrup to suppress it.
So meaning cough syrups are not to cure the coughing?
No, it's to suppress. You know, we have the suppressants. Some will help you bring out the phlegms and stuff. So it's curbing the symptoms, the cough mixtures. But sometimes your coughs may be due to a bacterial infection. That would be able, you know, when you report to the hospital, we'll be able to know from probably the duration and everything. So if there's a need to give you these things, we would give it to you either at the pharmacy or in the hospital. Not by you yourself prescribed, because if you do not, if it's not due to bacteria, and you took the cough mixture and an antibiotic, your cough actually resolved on its own. Because there's no bacteria for the antibiotic to go and work on anyway.
I understand.
So it has resolved on its own, but because you took it, you have the perception.
It's also a drug.
Yes, that's cured it. So at any point in time, you may come to the pharmacy that we should give you an antibiotic. Maybe you want an antibiotic, which would try to refuse you.
Oh, I understand.
Yes, we would refuse. Some people do not understand. I have my money. Why do you not want to sell it to me? And there are different classes of medications. We have over-the-counter medications. We have prescription-only medications. We have stuff we can give to you even at the pharmacy when you meet pharmacists. So if it's over-the-counter, we may not have that challenge of refusing to probably sell antibiotics for you. Antibiotics are prescription medications. So we may not have that issue. But even with the over-the-counter, sometimes I may notice you've bought a drug I know you're supposed to take within 3 days, a painkiller, because you're taking morning, afternoon, and evening, and it's 10 tablets. They return the next day to come and take the same thing. I, as a pharmacist, will be alarmed. What did you do?
You should be.
Did you swallow everything?
I understand.
Are you trying to kill yourself? Or what is going on?
Yeah.
So we use our discretion even when you come, even when they are over-the-counter medications. But there are different classes of medications and we handle them very differently.
I understand.
Yes.
So is it safe or is it advisable for me to search on Google or maybe ChatGPT or maybe one of the apps when I'm developing the symptoms to ask them like what might be the cause and those things? Is it good? Is it advisable to know?
If you are probably reading routinely, but you have professionals at your disposal.
Okay.
If you're having any symptoms, they may not be able to give you the correct thing. Google, anybody can place anything there.
Yeah, that's
it
true.
Doesn't go through any scrutiny.
Yeah, it's true.
Sometimes it's people's views.
It's true.
And everything.
Yeah.
And you may not even you can't type in your symptoms as it's actually happening to you. You come and sometimes give your symptoms and I ask you, is this also happening to you?
Yeah.
Because I'm trying to arrive at something. I know that it's possible you'll be having certain symptoms. Yeah. So I try to probe further.
Yeah.
You have Google do all that.
I understand.
Or ChatGPT do all that.
Yeah.
But then you have the medical professionals at your disposal.
Okay. So
especially with the pharmacists, we are in the community and we are with you. We are one of your closest and first point of call.
That's true.
Yes.
That's true.
When you come and we feel you have to go to the hospital, we advise you.
Yeah.
There are many times we refer people to the closest hospitals. Sometimes you would have to call and make an arrangement course.
Yeah.
But that's like first aid.
First aid, yeah.
So we are your first aid.
Yeah.
So consult and let's give expert advice.
The expert advice. That is what expert does here.
And
sometimes the money, sometimes looking at. So one thing is that I personally know a lot of people don't like going to the hospital. The reason for not going to the hospital is the fact that the queue, the bureaucracy, go and see this, see that, see this. My head is aching me. Go and, they will check your vitals. This nurse is telling you this, go and join this queue here, go and see a doctor, go and do this before they give you drug. Meanwhile, you know that the same drug you even pre-assume that this is the drug they'll give me. This is the same drug they will give you. Mm-hmm. That is why sometimes you just rush. Then you go to, I'm talking for everybody, yeah?
Yes.
You go to the pharmacist, we just tell them that, can you get me a para? And I know there are a lot of pharmacy in Ghana here. They will not even ask you what are you going to use it for. Mm-hmm. Which I know, ideally, if somebody is coming to buy drug, you should ask the person, what are you going to use it for? Do you have prescription? Do you have a history of what? Like, you should know all these details before you sell the drug to the person.
Okay.
Or am I lying?
Oh, yes, to some extent. But as I said, there are drugs we allow you to buy over the counter.
Okay.
We may not need to ask you so many questions. That's why I said if I suspect something, I'll probe further. Okay. You bought something from me previously.
The next day.
You're buying the same thing. Are you starting a pharmacy in your house? Are you killing yourself? Who is taking it? Yeah. Do you get it? At that first instance, once it's an over-the-counter medication, I may not probe further. Yeah. But sometimes I may also see your demeanor. I notice you look very ill.
Yeah.
I could probe further. Yeah. What's the issue?
Yeah.
You make your complaint. Maybe you've taken it for a while. Oh, can I run this test for you?
Yeah.
Now, most pharmacies do the rapid diagnostic tests like malaria,
sugar,
HB. Yes.
Yeah, that's true.
Let's try some. If it's a prescription, that one, I would ask for a prescription you don't have. We would have to probe further.
Yeah.
Sometimes you may need to go to the hospital.
Yeah.
You get it? Yeah. Someone who may just give you may come probably with frequent urination and having a lot of tests. And a friend may tell you, oh, it may not be that.
Yeah, it may be a different thing.
Yes. It may be that your glucose level has gone high or something. Maybe a condition you don't even know of.
Yeah.
So if you've met the pharmacist, oh, maybe with these symptoms, let's try and do this test. Let me check your glucose. I see probably it's not okay. Okay, maybe If it's too high, I could refer you.
Yeah.
Because it's very difficult because we do not do all the tests at the community pharmacy. It may be difficult to diagnose anything. But we are at your disposal now. People even put their contacts out there where you can call. You need to call the pharmacy and you need a pharmacist to talk to. They would refer you to the pharmacist. And you get most of the times free consultations.
That's
on very basic things. Yes. You could get these things, and it's, as the Bible says, lack of knowledge. For lack of knowledge, people perish. Yes. You may not know what is happening to you. People may have very severe headaches, and eventually we notice they have tumors.
In the
Probably
head.
yes.
Oh, I see.
And you do not know of that. And you keep taking painkillers. Every day we should give it to you. You're taking it for months, probably years. Its side effects may be lingering somewhere. Plus the root cause may not have been detected. So if you have any feeling when you go to the pharmacy, you can suggest that, could I get the pharmacist probably to suggest something to me? Yes, this is what I've been feeling. I've taken this. It's very good you give history. People also omit that when they even go to the medical officer's office. They will not tell them, I've taken this drug. This is what I'm taking before coming. But they'll get to the pharmacy and say, it is necessary that when you go and see your general practitioner, the medical officer, you give them a history of what you are on.
It's true.
Because you say that, we are not Sadia Mommy. But the doctor doesn't know you've taken Para for 5 days or taken Gibridol, which has diclo. And that could actually inform him. You may not have told him anything. But if you're able to give a bit of your history, it started this way, but I took this and this. This is the effect. We'll be able to help you better.
No, thank you so much. I meet boys a lot.
Okay.
Sometimes we talk. And you see a drug. They've written under the drug, it's not good for not for pregnant women.
Okay.
So I want to ask from the boys, is those drugs or abortion drugs?
Not necessarily. I understand very well.
So if it is not good for a pregnant woman, it
doesn't mean it's going to abort the baby.
Because
people actually employ that they try to do some things, give overdoses, and sometimes they get incomplete. As I said, when the drug is going through certification and we test it on, some I test it on animals. There are some that we will test on humans. You get it? Probably healthy humans, those who are a bit sick. It is very difficult to have trial on pregnant women.
Oh. Why?
I don't think you would allow your sister or your wife who is pregnant to go through a drug trial.
I understand.
Anything can happen. We can't, and we need to know it at all stages. Maybe the first 3 months, the first trimester, the second trimester, the third trimester. It is very difficult to get to do, not even want to do it.
That's right.
Once a while, sometimes you get to know by probably accidental injection. Someone accidentally took one medication and had an effect, then we noticed that it could do this to pregnant women. So sometimes it is not because some of them we've seen that it could worry the child. Okay. It could actually affect the pregnancy, but some of them we don't have enough data on it.
Okay.
So we'd like you to avoid it. Yes. Probably in future or eventually we'll get to know these things. You may not have done it in human trials.
That's true.
Maybe we did it in rats or animals and it had an effect on them, or maybe didn't have an effect on them. So we grouped them into several groups. So when you come to the hospital and we need to give any drug, we check the benefits and the risks. The doctors do the risk benefits analysis. Yes. So as I said, some of them it may not be absolute because we don't have data on that one.
Okay.
Then we check whether is it worth saving you, the baby, the pregnancy, and make an informed decision on it. So it is not every time that when we say don't let a pregnant woman take it.
Okay.
That will mean it's going to cause an abortion.
Okay.
But because of that, people may misuse these medications.
Yeah. That's
combine it so much.
Yeah.
Even if it causes that, maybe it's the way you probably gave it in excess. Maybe in its own therapeutic dose.
Yeah.
Maybe taking the 10 mils may not do anything. Maybe it's because you overdosed it.
Yeah.
In any case, it may not even bring out everything, and you'll be in the house, you don't even know that it's incomplete.
I get it.
And that could actually kill the person.
Okay, I understand. Thank you. Doc, please, you see, sometimes you go to the hospital, they give you a drug. They tell you, take this one, 3 morning, 3 afternoon, 3 evening, right? Then they give you another one. Mm-hmm. They said, take this one 1 hour after you've taken the first one, okay? Then maybe I'm maybe a mechanic or somebody, that my place is even far from the hospital, and I've missed the drugs, I've taken overdose. In that instance, what should I do? What first aid mechanism should I employ to make sure I will be safe and it will not affect my organs?
Okay, so in the era of overdose, there are several medications. Even when you have reported to the hospital, we do not use the same mechanism to treat an overdose.
Okay.
Each type of, potential poison has its antidote. A particular thing probably will use to reverse it.
Okay.
Maybe you don't have that knowledge, so you can't give you a general thing.
Okay.
If you feel you have missed up something, no matter how far you are
run to the hospital
from a health facility, get to the health facility, because that may be your only chance to save your life.
So
because you don't have information on what you have taken. You don't have any information on the chemicals that have gone into your body. You don't know why we wanted you to take just one tablet and what two can do to you at that time. If you come and it's not harmful, you'd have been cleared. But what if it's harmful and you come to the hospital?
I understand you.
So we would want you to return to the hospital, your nearest health facility, to report. If there's a need to refer you to a higher place, they will do it just in good faith.
Doc, somebody may be going through diarrhea.
Okay.
And what they will prescribe is buy Coke and add more salt. But me sitting here looking at even the sodium content of Coca-Cola is very, very high. And adding salt to Coca-Cola again, I don't know, but is it look, I'm trying to say that not only the Coca-Cola and the salt combination, there are a lot of indirect combination that sometimes you are anemic, your blood is low. They will tell you use malt and Coke and
milk,
tea tomatoes. Really? Like there are a lot of combinations.
Yes, from the house doctors.
From the house doctors.
I mean, fear doctors.
Fear doctors.
Yes.
And what do you have to say about that particular thing? It sometimes, I don't want to say it works, but some people have seen results to it.
Okay.
What do you have to say about that?
I'm so sure before even starting, the people may not have even tested their HP to know their blood level.
Okay.
The fact that you feel dizzy doesn't necessarily mean you are anemic.
Okay.
We can know you are anemic if you've run a test.
Okay.
And we will treat different types differently.
Okay.
That's why some of the people, we even give them blood transfusion.
Okay.
Some of them we can't just start with capsules or syrups. Some we can curb with these things. And there are a lot of things that probably had been done in the past and people perceive as giving results.
That's true. That's true.
Because you now said you had anemia. Then you said you've gotten healed. What did you use to measure?
The person
you were probably hungry.
Coke and tea tomatoes.
You were probably hungry. You took malt and you are full. It could be just that. It could just be that doing the issue.
Okay.
That's why I said now most of pharmacists even do HB.
Yeah.
At least to give us an idea if we need to refer you.
That's true.
We can refer you to this. There are a lot of conventional ways people, they'll tell you this plant, this seed can actually do this. But as I said, someone's HB may be 9, someone's own may be 11. They are different. Someone's own may be 6. The way we treat these 3 are all different. And we not respond to anything.
Today you have enlightened us on drugs and what to know before and after taking a drug. Right? And I think I'm much grateful for your time.
Grateful too.
You have some last words for us in regards to drug intakes.
Okay. Anytime I get a chance, I like to talk about antibiotics.
Okay.
Because the abuse has become a nuisance for us, because we are not having many new antibiotics being developed.
It is the old ones.
If occasionally you get probably something new has come, but it takes a long time to even produce a medication.
Okay.
So the ones we have in our system, we need to safeguard it.
Okay.
We need to really safeguard it. Someone has a sore and wants to open clanfinical.
Yeah, shikro, right?
Shikro.
Yeah.
Topaye fita.
Yeah, topaye, yeah.
Yes, we didn't even manufacture them for direct instillation into wounds.
Yeah.
Sometimes you have a reason we put it in the capsules, depending on probably where we want it to even dissolve or how we want it to work.
That's true.
So going and buying without a recommendation from your pharmacist or your medical officer is posing a lot of problems.
Interest.
Yes.
Yeah.
Because once you become resistant, you are affecting everybody, including when we give it to our animals, household animals.
Yeah.
Eventually, it has effects on us.
All right.
So the issue with antimicrobial resistance is that when you try to abuse them or misuse them, it ends up affecting the whole community and not just you. The day you need it, it may not work.
That's true.
So we have a policy, all or none.
Yeah.
When we give it to you and we say 5 days, you finish your course.
Yeah.
When we say 7 days, you finish your course.
Yeah.
If you are not comfortable with finishing that course, don't start at all.
Okay,
I can suggest you can come and we'll give you, then you feel that you may not be able to take it probably 4 times, some of them about 4 times a day.
Yeah.
Then if you report back, there could be substitutes we could get you.
Yeah.
Maybe it may be more expensive or branded. Once you can afford it, maybe you could go for it. Sometimes to our counselor, when we explain it to you, you may understand why you need to take it.
It's true.
So if we say 5 days, you need to complete your course, because when you do not complete it, it's like trying to kill a snake. You've done it partially.
So meaning,
or even a cat. You know when you try to kill a cat and you don't succeed and it comes out of whichever bag,
you are dead.
It can act like a lion. Like the family it comes from itself. Yes.
Sure.
So we need you to take it for a number of days, because that's a number of days probably we need to clear that infection. If you do not clear them, what doesn't kill you actually makes you stronger. They are not cleared, but almost sure also. Now they understand you anymore. Oh, this one, they just as you said, when you had a headache, you knew this is what they would give you. The same way they also know the drug. And next time you introduce it in a critical state, maybe you've had a surgery, we need to prevent infection because we can't afford to get you infected. We'll give the drugs and sometimes it's not working. So sometimes food drugs are not even working, especially with the antibiotics. Not because they are even reacting to it or something. Most of the times it's even due to abuse, so they become resistant to it and it's not working. So please, let's treat antibiotics with a lot of care. Let's not walk in and buy amoxicillin, Flagyl, clanfinical, topaye. If you are if the pharmacist or the pharmacy staff decides not to give it to you, take it in good faith. Then ask for their suggestion.
That's true.
Their suggestion may do more than what you think the drug is going to do. So let's be custodians of antibiotics and let's together reduce resistance.
Thank you so much. when you come to this show, what we do is that we allow you to give out your contacts. Okay, because it's an expert desk, some people might need your expertise on their daily lives and daily activities. So we allow you to give your contacts and maybe your social media handles for anybody who wants to, contact you from the whole world. Like when you call or you chat, the person can reach you.
Okay.
So you give that contact out.
That's fine. For all your drug advice. We are available to you.
Try and test it.
Okay, so you can reach me on 020-824-8543. I'll take it again. 020-824-8543. Thank you. I hope you got that.
And the social media too. Do you have some social media handles that are active?
Active is a big issue.
But
if you go there,
I think we need to, we want.
I may see it after 2 months.
No, yeah, I understand. So I think you should go with a number. You want to call the number anywhere you are talking from. Your condition, just explain to her. She would have the time to give you an expert advice on how best to go about it. If you need to see a doctor, if you need to do some tests and other things, she would prescribe a text for you, then you go and do it. So after doing it, then maybe
you have to refer to a medical officer. We always refer. Because we work together with them. We don't work in isolation as they work with us. But sometimes you may think it's just something you can buy para for. But when you report, be like, go to the hospital. This needs, it's not just something we should be handling here.
So we will have our part 2. That will be dependent on what you say. If you feel like the part 2 should come, just type part 2 at the comment section, and like, subscribe, and share this to anybody at all who will also be blessed with this piece. Thank you so much.
Thank you too.
My name remains EKO Eric Kwame Odame.
All right. Bye.
Bye.